Smoking cessation helpful tips. Smoking cessation or quitting could be very challenging with the chances of relapse if not properly planned or executed. Luckily, there are right methodologies and strategies available to help someone to achieve personal smoke quitting goals. Note: the success of a smoking cessation plan mainly depends on the person who wants to quit smoking. Please keep in your mind, if you don't want to help yourself, no one else can. Following are few helpful tips. 1. Plan a quit date. Pick a date inside the following 14 days to stop smoking. This gives you sufficient opportunity to get ready without losing inspiration. Tell companions and family. Illuminate your companions, family, and collaborators about your quit day. Their help can be critical. Eliminate smoking paraphernalia. Dispose of all cigarettes, lighters, ashtrays, and other smoking-related things from your home, vehicle, and work environment. 2. Understand your triggers. Distinguish triggers, perceived circumstances, exercises, or sentiments that make you need to smoke, like pressure, espresso, or after dinners. Plan alternatives. Foster procedures to stay away from or adapt to these triggers. For instance, bite gum after dinners or practice profound breathing during unpleasant minutes. 3. Consider nicotine replacement treatment, also called NRT. There are different kinds of NRT products available. Some of those products are prescription drugs, some are over-the-counter. Talk to your healthcare provider regarding available options. Includes nicotine patches, gum, capsules, nasal showers, and inhalers that can assist with diminishing withdrawal side effects. Counsel a professional. Talk to your healthcare provider about which sort of NRT may be best for yourself and how to really utilize it. Without talking to your healthcare provider or seeking professional help would cause relapse. 4. Medications. Prescription medications includes bupropion or Zyban and varenicline or Chantix can assist with decreasing desires and withdrawal side effects. Counsel your doctor. Examine these choices with your healthcare provider to check whether they are ideal for you. 5. Behavioral support. Counseling, individual, gathering, or phone advising can offer help and abilities to stop smoking. Support groups. Join a care group for individuals who are attempting to stop smoking. Sharing encounters and systems can be extremely useful. 6. Adopt solid habits. Exercise. Active work can lessen desires and withdrawal side effects. Solid diet. Eating a reasonable eating regimen assists your body with recuperating from the impacts of smoking. Remain hydrated. Drink a lot of water to assist with flushing nicotine and different poisons from your body. 7. Manage stress. Unwinding techniques. Practice unwinding procedures like profound breathing, contemplation, or yoga to oversee pressure. Hobbies. Take part in leisure activities and exercises that keep your psyche off smoking. 8. Stay positive. Set little goals. Celebrate little achievements and prizes yourself for remaining sans smoke. Gain from mistakes. Assuming that you goof, cheer up. Examine what prompted the slip-by and use it as a growth opportunity. 9. Use portable applications and resources. Stop smoking apps. Numerous applications offer help, track progress, and deal tips and inspiration. Online resources. Sites like smokefree.gov offer instruments, tips, and backing for stopping smoking. 10. Seek proficient help. Specialist or specialist. Talk with medical services experts who can give direction, support, and potentially drugs to assist you with stopping. For complimentary help and assistance, look for your local area smoking cessation programs, phone services, or online websites and services. Please talk to your healthcare provider or pharmacist if you need additional information. Without professional advice, using some of these products could be harmful for your health condition. Thanks for watching. I hope you like this video. Stay happy, healthy, and safe.